The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. With me today is my co-host, Vin Martello, our Director of Community Health Relations. Good morning, Vin.
Good morning, Dr. Smith. How are you today?
Good, thanks.
Dr. Smith, today we're talking about a topic that is commonly known, but some people don't fully understand the depth of it. And that is rabies, which can be a very serious condition if undetected and untreated. And on that note, we have our very own James Rodden, who is an environmental health manager at the Ulster County Department of Health, has worked. James is a graduate of the State University of New York at Albany with a bachelor's degree in biological science. He's worked with us at the Department of Health since 2000, and he works in a wide variety of areas, most notably in what are called vector-borne diseases carried by insects, including mosquitoes that may carry West Nile virus, Zika, tick-borne illnesses, and today's topic, rabies. Welcome, James. How are you?
I'm great. Happy to be here.
Yeah, great. James, let's start at the basics. What is rabies and why do people need to be concerned?
Well, rabies is a virus. Rabies is a fatal virus if not treated. Rabies is spread by the bite of an infected animal. That animal becomes infected by being bitten by an infected animal, and it's a cycle. Rabies is what we would call a zoonotic disease. It is endemic to our area, meaning that it's here in the wild population and it's here to stay. It is somewhat seasonal, but that's also because of the activity level of the animals. Rabies is spread through the saliva and only the central nervous tissue of an infected animal. The only way you can really get rabies is to be bitten by a wild rabid animal.
And what type of animals carry rabies? What species, I should say?
Mammals in general can get rabies. Small mammals, things like rabbits and squirrels and chipmunks, are not capable of transmitting the rabies virus in the wild. In some really unique circumstances, they can, maybe farm raised, but if you get bit by a wild squirrel, you can't get rabies from it. Raccoons, skunks, foxes, your house cat. Of course, everyone thinks of rabies with dogs. Your dog can get rabies, but we vaccinate our pets, and that protects them from getting the rabies virus.
Well, we actually see more cases in cats than we do dogs, generally speaking, right, James?
Absolutely. It's the nature of how people care for their cats. Cats are, semi-wild animals at times, and, people let them out for the whole day. They're out mixing it up in the woods with everything that's out there. And we do, on a yearly basis, have wild feral cats that are test positive for rabies.
Well, there are some instances where you might know that you've been bitten, say by a wild animal or a cat or a dog, but there are others where you might not know. Right. Is that correct?
Well, that would certainly be the case if with a bat exposure. That was one of the animals that I didn't mention on the list of animals that we associate with rabies. Bats also can have rabies. You could be asleep and you could have a bat land on you, and you could be bitten and not be aware of it, and that would constitute a rabies exposure.
And what do you do if you know you've been bitten or even suspect that you've been bitten? What are the next steps for you? Well, first we're going to preface that with saying the best thing to do is if you see a wild animal, try to avoid it.
Absolutely.
Just let it be. It's great to watch wildlife, but just try not to touch it. If you are bitten by an animal, specifically a mammal that could be a rabies vector species, you definitely want to call the Department of Health right away, and you can talk to the rabies people, or you could.
That would be you, right?
That would be me. I would certainly recommend you contact your personal physician and let them know that you were bitten by an animal. And if if at all possible, we like to have the animals tested for rabies when there has been a bite.
And that can potentially save you from having to go through a prolonged and somewhat costly treatment regimen. Is that right?
Yes, the preferred thing would be to have the animal tested. Unfortunately, there's only one way to have that test be done, and that's the animal does have to be euthanized, which is difficult for us at times to explain to a pet owner that they have to euthanize their beloved pet. But if human life is more important, that's just what it comes down to. If the animal is available for testing, we, at the health department, we take care of all the paperwork and the processing. We ship the specimens to the New York State Department of Health Rabies Lab in Albany, where they test all specimens the same day. That's how critical rabies exposures are. Time is of the essence. We want people who have been exposed to be able to get treatment as soon as possible.
Now, if you've been bitten by a domestic pet, that has gotten its rabies shots, does that mean that you're not automatically not exposed to rabies, or what is the protocol there?
Well, a domestic pet, as long as it's if it's a mammal, which and the 3 domestic species that will fit the description of what I'm about to explain are cats, dogs, and ferrets. Those are animals that there is an approved rabies vaccine that is given to those animals as pets to protect them from a rabies exposure and also to protect your family from being exposed to rabies from your own pet. So in a situation where it is a known dog, cat, or ferret, an animal that can be observed for 10 days, as long as that animal stays symptom-free for 10 days, and which would include a visit from someone from the Department of Health or from a veterinarian, as long as that animal is alive and healthy in 10 days, there's no chance that animal could have had an active case of rabies at the time of the bite. That doesn't mean that 4 months down the road, that animal couldn't actually come down with rabies. It's just that there's a very small window of time in the sequence of the rabies virus as an illness where it is actually transmittable to someone through a bite.
So, does that include also have the owner having to demonstrate that show proof that the pet has been vaccinated with rabies vaccine?
Well, we certainly encourage all pet owners to vaccinate their pets. A dog can't be licensed in New York State unless it has a valid current rabies certificate. There is a 10-day bite protocol for domestic animals, house pets. Those animals can be observed for 10 days after a bite, providing that they remain symptom-free from any rabies symptoms, which would include unusual aggression or an animal that's typically shy becoming very gregarious and friendly, or walking in circles or falling down. Those are all signs of rabies. And of course, the classic symptom, the excessive drooling, because the rabies virus actually infects the salivary glands as part of the progression of the disease, and that's where the saliva comes from. So that animal can be watched for 10 days, doesn't develop any of those symptoms, then we can be 100% positive that that animal is free of rabies at the time that it bit you, whether it's vaccinated or not.
Interesting. And are there any cases where perhaps the pet might be carrying, or an animal might be carrying rabies but not have active symptoms of it?
That's very possible, and that is the reason that we, in some cases, mandate that animals be quarantined, actually, a strict quarantine. If your cat goes out for the day and it comes back home and it's got an unexplainable wound on its face, it looks like it got in a fight, if that animal is not vaccinated, the health department will mandate that animal has to be kept in confinement, strictly quarantined for a period of 6 months to demonstrate to us that there is no chance that rabies was transmitted to that pet.
There's also a protocol for giving the booster shots of a rabies vaccine to the pet that's already been vaccinated if they've been exposed to a rabid animal.
That is a very good practice when someone has a pet that, even if the pet's up to date on their shots and they come home with an unexplained injury, or if your dog kills a raccoon and someone brings it to the health department and we do have it tested, if that animal tests positive for rabies, we will encourage the pet owners to get their animal boosted. The great thing about the rabies series for pets is it is absolutely effective as long as you keep your animals up to date.
So you should always, if your dog, if you have the opportunity, if you're a dog or a cat or a pet has gotten into a fight with a wild animal and you can acquire that wild animal safely, that's a good thing to do, to bring it to the health department.
That is the best option whenever the animal is available for rabies testing, because it'll let us know within days with 100% certainty whether or not someone needs to begin rabies treatment.
Mm-hmm. And what happens, maybe Dr. Smith, you could answer this. What are the symptoms? How long does it take for rabies to take hold in a human, and what are the symptoms? Do you know offhand what they are?
Well, it can be over several days, actually. It depends on the person's vulnerability, too, to the viral infection and how much they've gotten in terms of the exposure from either the bite or actually having the saliva of the rabid animal connect with your mucous membranes or eyes or that sort of a thing. You can acquire the infection. So it is primarily the bite, but certainly just by the exposure of the saliva to your vulnerable body parts that could certainly happen.
And what is the treatment protocol for a human being may have been exposed to rabies? James?
The rabies shot series is available locally at the Kingston Hospital Emergency Room. It has to be authorized by the health department before it can begin. It's a series of 4 vaccinations spread over a period of 14 days. You would get a rabies vaccination shot on your day that you appear. You would come back on day 3, day 7, and day 14. At that point, you would be considered completely protected. In addition to the first dose of rabies vaccine, there is a second serum administered. We call it rabies immunoglobulin, which is a very large dose of antibodies to the rabies virus. And that's the idea of that is to help your body ward off the infection before it even has a chance to spread.
Mm-hmm. And so missing one of those 4 is a no-no, right?
You want to stick to the series, and if you do get even out of sequence, we can make adjustments to your treatment and just get you back on sequence and make sure you get all 4 of your shots.
Mm-hmm. And worst case scenario, what happens if you have been exposed to rabies and it goes untreated?
Unfortunately, it generally ends in death.
Really?
It's a fatal disease.
Yeah, so some people might not fully understand that, right? Because we've all heard about rabies, but some may not know that that's a consequence of
absolutely, yeah,
not getting treated. Well, there's a lot more great information about rabies, and we're going to get to all of it right after this short break. You're listening to Healthy Ulster Radio.
In emergency care, it's all about experience. At Health Alliance Hospital Broadway campus, a member of the Westchester Medical Center Health Network, it's another way we're investing in you. We're board certified in emergency medicine, nationally recognized in stroke care, and use telemedicine to give patients access to the region's leading specialists. Patients tell us we make their experience exceptional by treating them with the utmost respect. Health Alliance Hospital Broadway campus. We're advancing care here. Visit hahv.org for more.
Welcome back. You are listening to Healthy Ulster Radio. Our topic today is rabies, and our special guest is James Rodden, who is one of our senior managers in our Department of Health. James, could we sponsor rabies clinics through our department? Maybe you can talk about that and how people can find out about those.
Every year, 3 to 4 times a year, we do fund rabies vaccination clinics for pets, cats, dogs, and ferrets. That's paid for by the help of a grant from the New York State Department of Health. We supply the shots free of charge. Our next rabies clinic actually will be August 12th. It's from 8:30 to 10:30 a.m. It will be at Kingston Animal Hospital on Albany Avenue in Kingston, New York. We partner with Dr. Rugg. They do ask that you keep your dog on a leash, your cat in a carrier, or your ferret either in a carrier or leash. They don't want dogs and cats running around free because they do get a bit of a lineup there waiting for the shots. It's a very important public service that we provide. It's a great thing, and I mean, who doesn't like something for free?
Absolutely.
And aside from vaccinations, what other preventative measures, James, can people do to protect their pets? And then maybe, you can elaborate a little bit about what folks can do, like around their homes and yards and around with their children and so on.
Well, the message I would like to get out there is if you see wild animals, just leave them alone. We live in a nice rural area. Even in our urban centers, we have a lot of wildlife. We get positive rabies specimens in the city of Kingston every year. I mean, we've had a raccoon this year. I think there was a cat that tested positive as well. You can limit the amount of time you leave food outdoors to feed your cats, especially nighttime. Bring the food in. If you have a pet door, close the pet door, because there's nothing to keep a raccoon from coming in your pet door, and they will raid your refrigerator. We've had cases where people have been very, very concerned that they may have, had an exposure to the rabies virus after they've seen a raccoon eating out of their cat bowl, and then they'll go out and grab the bowl, go inside and wash it. And everyone's always afraid that if they touch that area that the raccoon had been licking, that they're going to get rabies. Secondary exposures are very uncommon. You would have to have, a pretty significant amount of saliva from that animal get into a open cut, which has literally bled within the previous 24 hours. To even have a potential secondary exposure like that. The main route of exposure is always going to be direct contact with saliva from a rabid animal through a bite. Mm-hmm. Another thing to keep in mind regarding potential exposures and just feeling safer in your own home is rabies is not a blood-borne disease, in that there is no rabies virus in the blood of an infected animal. It's only in the saliva and in the central nervous system tissue. And most people are not going to be exposed to the brain of a rabid animal. That could be a danger if you are a taxidermist or if your dog really mauled something. But again, use gloves. If you're gonna clean up your dog or your cat after it's had a fight with a wild animal, you want to protect yourself. You're looking out for the best interests of your pet. So common sense goes out the window usually, and these incidents tend to happen in the middle of the night, which makes it even harder for folks, and their instinct is to protect their pets. So protect yourselves and your families first. Mm-hmm. Your pets should already be vaccinated. You aren't.
And what about, say, if you're a parent and your kids are playing out in the yard and you notice like a wild animal, has been come into the yard somewhere, maybe not something that is overtly threatening. Should you bring your kids in temporarily, or for a while, or have a?
And that's a great idea, Van. That's a good point. Be aware of what's going on in your surroundings, and you would definitely want the children to come inside, maybe make a call to the neighbors and say, hey, make sure your kids and your pets are inside. I've got this coyote that keeps coming in the yard in the middle of the day and acting strangely. There really is no official service provided locally to dispatch, a potentially dangerous animal that's on your property. You can call your local police department, but it's completely at their discretion as to whether or not they're going to come and actually, shoot a raccoon that's got you pinned down on your front porch. They worried about the safety of the public and of their officers as well. We get a lot of calls and people expect the health department to come out and dispatch dangerous animals. It's just not a service that we provide. We will, if someone does make a call to us, so we will recommend state licensed nuisance wild control people. There are.
Yeah, I was just about to ask that. I know there's some out there.
Yeah, well, there is a New York State Department of Environmental Conservation list of licensed nuisance control officers as well as wildlife rehabilitators. There's a lot of do-gooders out there, and people see a hurt animal on the side of the road. They want to stop and help it. You end up usually getting bitten. The animal runs off, and then you have to go to the emergency room and get rabies shots. Just
interesting.
Enjoy wildlife from a distance.
Mm-hmm. And what about? I know bats are very helpful creatures in the ecosystem because they play a big role in controlling insects and so on. But what happens if you discover a bat or bats in your home? What's the best thing to do?
If you particularly if you awake to a bat in your bedroom and the doors are closed, or there is an unattended child sleeping someplace with an open door, it's imperative that you catch that bat. I know it's hard to get some people to, when they're so terrified of bats, but bats are an important vector of the rabies virus. One of the problems with bat rabies is that if the bat's flying around your house, you can't tell the difference between a healthy bat and a non-healthy bat. It's not going to manifest the disease the same way that a raccoon or a fox or a skunk is going to act. The best thing to do is to grab your broom or something and give that bat a good whack and knock it to the floor and get it in some kind of container. Contact us at the health department, and we will receive the bat from you. We will send it up to the rabies lab. They'll immediately test it. The bat rabies there have been documented cases of people coming down with full-blown rabies. They find out after testing that it's the bat variant, and they have had no known exposure to a bat. So bats in your house are a problem. You can, if you're noticing, numerous bats, call a pest control company, and they can do some bat proofing. They can do some things to remove the bats from your attic or wherever they're roosting. Bats are great creatures, as has been said. They eat a tremendous amount of bugs. They're an important part of our ecosystem, and we don't like to see them die needlessly. But you definitely don't want to let a bat out once it's in your house.
And they can get into they can get through the tiniest crevices, right, and openings that you might not even be aware of yourself.
It can be very difficult to figure out how the bats are getting in, and it seems that once they've found a location that they like, they keep coming back.
Mm-hmm. And I've heard, I don't know if this is true, maybe you could tell us, that bats, and maybe it's a wives' tale, I'm not sure, but I've heard that bats have such fine needlepoint teeth that sometimes you don't even know if you've been bitten. Is that correct, or it doesn't?
They're a tiny animal, and
right.
Yeah, their teeth are very, very tiny. So it certainly, you may think you've gotten bitten by a mosquito or a fly or something, and it could just be a little raised red area. But I think the key here is that if that bat is in the room and managed to get into this closed room while you were sleeping, you really do have to make sure that bat does not carry rabies.
Right, because you're not wanting to take a chance with a fatal disease, right?
Exactly.
So it's always err on the side of caution. Mm-hmm. And prevention. This is all really great information. James, if people want to learn more about rabies and reach you as well, where do they go to do that?
Well, there are several ways to get a hold of us. You could certainly just call us at the Ulster County Department of Health Environmental Services Division at 340-3010 and ask to speak to any one of the staff members who are in the rabies program. We can be found on the internet. We have our own webpage, the Ulster County Department of Health, or you can get us linked through ulstercounty.gov off the main county page. Mm-hmm. A great source of information about rabies can be obtained from the New York State Department of Health's website as well. There's a lot of information there. The Centers for Disease Control also has quite a bit of useful information about rabies available online.
Mm-hmm.
And also not just about the disease, but about the vaccine and what to expect in the series that you would have to receive, that sort of thing. So, it's both the State Department of Health and the Centers for Disease Control have a great deal of information about all aspects of this topic.
And that rabies vaccine, say you live somewhere far away from Kingston and Ulster County, do you first go to your local healthcare provider, and then that person directs you, or
that is one route of getting the ball rolling. The reason I mentioned the Kingston Hospital emergency room is that we have a contract with them. Each county in New York State is required by public health law to provide rabies shots to the public, to people who are exposed. So we have a discussion with the exposed people to determine their level of risk of rabies exposure from whatever the encounter was with an animal. If after consultating with us and also sometimes with the State Department of Health, we decide that that person has a reasonable risk of rabies exposure, we do send them over to the hospital. The health department will pay any unreimbursed or uncovered expenses directly relating to the vaccination for rabies for the series. We can't pay for your stitches from being bit by a dog, but we will make sure that every person in Ulster County is given the opportunity to get rabies shots, and cost should not be a factor.
Right. And so the bottom line is get to Kingston Hospital to the emergency department. Is that right?
That's correct. We can authorize an emergency room outside of Kingston Hospital to give a person who was exposed in Ulster County rabies shots if you live closer to Poughkeepsie. But we can only be financially responsible for folks who actually go to the Kingston Hospital where our contract is.
And also be responsible for bites that occurred within Ulster County. So as you said, if you live in Dutchess or Orange, but your bite occurred in Ulster, the county department where the bite occurred is the one responsible for.
So James,
correct.
very quickly, give us that phone number again for the health department where people can call.
The phone number for the Environmental Services Division is 845-340-3010. I can be reached anytime as well at 340-3021. And I'd be happy to answer any questions folks have about rabies.
Great. Well, thank you so much. You're so knowledgeable and helpful, and it's a pleasure to have you as a guest and to work with you.
Appreciate the work you do for us every day.
That's all the time we have for today. You're listening to Healthy Ulster Radio. Tune in next week for more great information that you can use to keep yourself, your family, and your community healthy and strong. Bye-bye.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.